Hi, my name is Jessica Hudson. I'm a first-year fellow in the Cardiothoracic Surgery program at Duke. I think that in the big picture, the difference between a 2- and 3-year program along the length of training required to be a CT surgeon is rather trivial. For me, it was more about how does that program use that 3rd year in terms of benefiting my career and my training. My interest is general thoracic surgery, and I plan to use that 3rd year to continue that training, the autonomy, and experience necessary to launch a career in general thoracic surgery and lung transplantation. It goes without saying that the training here will be fantastic, but that was also true for many other training programs I considered. For fellowship, the quality of the training is sometimes not enough. What I also considered was fit, and not just for me, but also for my family. We weighed the pros and cons both for our career paths as well as the cost of living in a city when we have 2 small children, as well as the social support that would be provided. But in the end, it came down to the people. As I said, the training will be fantastic, but your co-fellows and your faculty are the family that you don't get to choose, and you spend more time with them than your own family. In Duke, I found a environment of collegiality, of support, and general concern for everybody's well-being, which was rather antithetical to their historic reputation. But also very importantly, I found faculty that cared about me both as a person and as a trainee, who were also leading careers and providing quality patient care in a way that I would hope to emulate. Like many of you, I had an Excel sheet that listed many criteria explaining the differences between the 2 programs, or the several programs, whether their location, their supposed case mix, their faculty grants, whatever was important to you. That was helpful for choosing which programs to apply to. But trying to figure out where you want to spend the next 2 to 3 years of your life, and what came down to a more important list. After I finished the interviews, I made just a Word document where I aligned my thoughts, my observations, my concerns, but also the thoughts and questions for my spouse. It was reviewing that list with those insights that really helped us form our rank list, because frankly, after 2 to 3 interviews, they all start to muddle together when you throw in the sleep deprivation that residency provides as well. Unfortunately, my traditional advice doesn't apply as much this year since you're interviewing from afar. Normally, I say that the interview dinner is the most important piece of the weekend. I learn more about the people and their interactions and about the ethos of this program at that dinner, more so than the interview day. But something else that I did was I reached out to the fellows, both present and past, to have off-site and candid conversations about their experience and their reflections on their training, and that is still something that you can do even from afar. My last piece of advice would be don't shy away from asking for their actual case log numbers. Look at of their graduating residents and truly see the training that's being provided. So the concept of balance is always touted, but I think it's a misnomer. There's no way you're going to have a balanced life as a surgical trainee, maybe even not as an attending. The work we do requires imbalance. But there's a way to blend your 2 worlds, and that's what I strive for. My children know that there are times when patient care wins out and I won't make it to bedtime or to, I guess there's Zoom dance recital nowadays. But my colleagues also know that I have important things in my life outside of work, whether it's simply asking to see pictures of my children or acknowledging that it's getting late should you call them. Those little things really actually go a long way to acknowledging that you're a real person outside of the work that you're doing. But ultimately it comes down to having a good, supportive partner who is doing the brunt of the work behind the scenes, the house cleaning, the shopping, the childcare. And what I think that one of the reasons we chose Duke and Durham was the career opportunities that the Research Triangle Park and Durham itself offers for those that are helping to support us through this strange, crazy, and insane life that we've chosen. So one of the other things that attracted me to this program is that there were people whose life slightly mimicked my own. That's not to say that we had the same skin color or childhood upbringing, but people who had responsibilities outside of the hospital that had to learn to balance those. Other people who had children or ailing parents or, working spouses that they were helping to support. I think that feeling like you're not alone in your own struggles on your hardest day is important. There was a training program that I looked at that hadn't trained a woman since 1993. That's not to say that a woman couldn't thrive there, but I didn't want to be alone. And at Duke, I found that there were people along all spectrums of life and all life experiences that could resonate with me on multiple different levels, and also made me feel like I had something to contribute as well.